shortage of toilet paper in the
You could
tunnel area
potentially
here for about
cause eye
$12.
problems. You want to be careful. So,
Kimberly
when
Clark,
the president
specifically
he
this
actually
manufacturer,
said, "Why not?
we've got
Let's
pretty much
use
all the
it.
equipment
It's
in this
it's not going to kill
factory they put
anybody."
on a
That's
second shift.
not true. If
She
used
has
in the
to
right
announce to the press
dosage,
that they
sure, it would
apologize.
be
There's a
safe.
shortage
But
of toilet
that
paper.
there
All
is
the stores
again
will
that
be
narrow
restocked
margin between a
tomorrow morning,
therapeutic
and they will
dose
deliver
and a
word.
toxic dose.
Elizabeth, President Trump telling the US Federal Emergency Management Agency, or FEMA, to help 3 of the hardest hit states in the US. The head of FEMA explains what's being done. Have a listen.
We have medical supplies en route to these states, including respirators, surgical masks, gowns, face shields, coveralls, gloves, with quantities already delivered to both Washington, New York, and California.
This, it must be said, in response to much criticism about the pace of delivery of these really important equipment that the medical experts need. How soon will these much-needed medical supplies be in the hands of healthcare workers?
Well, we're told that they will be there very soon, really just a matter of days until they're in the hands of medical care providers. The issue, Becky, is it enough? I mean, you can throw around whatever numbers you want. The question is it going to be enough? They are trying to get it to the right places, not distribute it evenly across the U.S., because there are pockets of this you referenced early in your show. For example, California, Washington State, New York City. And so it obviously needs to get to those places. These are doctors and nurses who usually during regular times wear a mask once, throw it away. That's the right way to do it so that you don't contaminate the next patient or yourself. Right now, they're sterilizing them, they're laundering them, they're doing all sorts of things which hopefully will be safe, but is not the right way to do it, not the safest way to do it. So hopefully this will be enough. Hopefully there is more coming, but really we are hearing from all corners of the United States how there's such a shortage of this equipment.
Finally, there has been a lot of confusion in many parts of the world as to what lockdown really means, as opposed to perhaps what strict social distancing means. This on the 2-month anniversary of the lockdown in Wuhan, China is marking its 5th straight day of no new cases. The UK is still considering whether it needs to go further with more swinging measures with regard a lockdown at this point. What's the answer here?
The answer is that each country and even, sort of each state or even each in the United States, each county has to decide what is going to work for them. I think that, the general consensus has been, sort of let's be careful. Let's have there's no room for error here. Let's be careful. Let's do more. It's a bit of an issue here in the United States. We're all supposed to be social distancing. And so, for example, that means staying home. That means going out only if you're an essential worker. I am actually speaking to you from my home studio right now. Only go out if you need groceries or need to pick up something at the pharmacy. But, as we've seen in these videos, there are young people having fun on Florida beaches, right up next to each other. That is not social distancing. They need to do better. So it's been hard to enforce this. Now, on the other end of the spectrum, you have lockdowns in other parts of the world, and a lockdown is even more severe than social distancing. That means you don't leave your house. And so there are various methods of trying to get people the essential things that they need. That will, give you the necessities that you need. That's, the most severe form of this.
All right. It's always a pleasure, Elizabeth, working out of your home, doing an extremely good job. What I know is very trying circumstances. Thank you very much indeed. Want to hear from you, folks. Do share